Good morning, Doctor. Good morning, everyone. And as Dr. Murthy mentioned, I want to provide an update on vaccine effectiveness. Today, we are releasing 3 articles in MMWR with data I will now describe that are helping to inform our booster plans. Recognizing that for most vaccines, there is a reduction in protection over time, we have been analyzing the data closely from a number of cohorts in the United States and around the world to understand how long protection from the initial COVID-19 vaccine series will last. Examining numerous cohorts through the end of July and early August, 3 points are now very clear. First, vaccine-induced protection against SARS-CoV-2 infection begins to decrease over time. Second, vaccine effectiveness against severe disease, hospitalization, and death remains relatively high. And third, vaccine effectiveness is generally decreased against the Delta variant. So let's jump into the data. On this slide, you will see 2 studies, one from New York and one an analysis of data from the Mayo Clinic. From May 3rd through July 25th, New York examined COVID-19 tests and linked them to individuals' vaccination status based on the state's vaccine records. This allowed New York to study vaccine effectiveness against infection over time for more than 10 million New Yorkers of all ages. Vaccine effectiveness in May, early during the vaccine rollout in the state, was 92%. In the later months, further from vaccination, vaccine effectiveness declined to 80%. These data will be published in the MMWR today. The Mayo Clinic analysis looked at vaccine effectiveness for both the Pfizer and Moderna vaccines among over 80,000 vaccinated and unvaccinated individuals across all age groups with data through July 16th. Like we saw in the New York data, vaccine effectiveness against infection declined over time. In this case, from 76% to 42% for those who received the Pfizer vaccine, and from 86% to 76% for those who received the Moderna vaccine. These data are currently available on a preprint server. Today, CDC will also publish data from our National Healthcare Safety Network, a nursing home cohort where we analyzed more than 85,000 weekly reports from more than 14,900 facilities. Weekly COVID-19 case counts were used to evaluate vaccine effectiveness over time. These data demonstrate that vaccine effectiveness declined over time from 75% in March to 53% as recently as August 1st, 2021. This represents a substantial decline in vaccine effectiveness against infection among those who are most vulnerable, including during months where Delta was the predominant circulating variant. Taken together, you can see that while the exact percentage of vaccine effectiveness over time differs depending on the cohort and setting studied, the data consistently demonstrate a reduction of vaccine effectiveness against infection over time. Importantly, though, despite waning vaccine effectiveness against infection, data analyzed through July continue to demonstrate a stable and highly effective protection against severe illness and hospitalization for people who are vaccinated. Included in the same reports described before, data from New York State and Mayo Clinic also show that vaccine effectiveness against hospitalization remains relatively high, both over time and during periods when the Delta variant was surging. CDC will also publish today in the MMWR data from the Ivy network, which examines data over 3,000 adults admitted to 21 hospitals across 18 states between March and mid-July. This report compares vaccine effectiveness against hospitalizations early after vaccination, within 2 to 12 weeks, and later after vaccination, between 13 and 24 weeks, and found that vaccine effectiveness against hospitalization remained high. However, in this study, only about 7% of samples sequenced were the Delta variant. Taken together, these data confirm that while protection against infection may decrease over time, protection against severe disease and hospitalization is currently holding up pretty well. As we make decisions about boosters, though, we also have to look at vaccine effectiveness in the specific context of the Delta variant. Preliminary data through August 6th from 2 of our vaccine effectiveness cohort studies that include more than 4,000 healthcare personnel, first responders, and other frontline workers in 8 locations across the country, show waning effectiveness against symptomatic and asymptomatic infection in the context of the Delta variant, from 92% prior to Delta to 64% with Delta. Notably, this analysis did not show difference over time, which suggests effectiveness is also decreased against Delta, independent of when you were vaccinated. These data suggest full vaccination in the context of the Delta variant may be correlated with less protection against SARS-CoV-2 infection than against prior variants. To be clear, our top priority is to save lives and prevent severe infections. The data we will publish today and next week demonstrate that vaccine effectiveness against SARS-CoV-2 infection is waning. And even though our vaccines are currently working well to prevent hospitalizations, we are seeing concerning evidence of waning vaccine effectiveness over time and against the Delta variant. Additionally, reports from our international colleagues, including Israel, suggest increased risk of severe disease amongst those vaccinated early. Given this body of evidence, we are concerned that the current strong protection against severe infection, hospitalization, and death could decrease in the months ahead, especially among those who are at higher risk or who were vaccinated earlier during the phases of our vaccination rollout. In the context of these concerns, we are planning for Americans to receive booster shots starting next month to maximize vaccine-induced protection. Our plan is to protect the American people and to stay ahead of this virus. Before I turn things over to Dr. Fauci to share the immunologic data informing our decisions, I want to emphasize one final thing. Our vaccines continue to offer the best protection against severe COVID illness. While we are still learning about how these vaccines perform over time and how long they will last against emerging variants, one thing is very clear. Getting vaccinated can keep you out of the hospital. Getting vaccinated can save your life. In areas with low vaccination coverage, we continue to hear far too many heartbreaking stories of people who did not get vaccinated, only then to get severe COVID-19. In these areas, the data are showing us that the more people who are in the hospital, and tragically, more people are dying of COVID-19. We are currently averaging over 500 COVID-19 deaths per day, and these remain largely preventable. If you are still unvaccinated, please get vaccinated. The single best action you can take to protect yourself and others is to simply get vaccinated.